Hello everybody, some of you will recognise me from the practice. For those of you that don't know me, my name is Faye Donald and I'm one of the registered dental hygienists at York Place Dental Practice. As some of you will be aware, dental practices in England have been asked to close during the current lockdown period, and at the moment we don't know how long it'll be before we're allowed to open again. So in the meantime, I wanted to reach out to you firstly to offer you some reassurance that we are still all here behind the scenes, and secondly to give you some useful tips on how to keep your teeth and gums healthy whilst you can't get into the dental practice. Plaque is a soft sticky layer of bacteria that's constantly forming on the teeth and along the gum line. It can be easily removed at home with good regular brushing and good incidental cleaning. If all of the plaque isn't removed every day, it will mature and cause irritation and inflammation, which can make the gums appear red and swollen and will often result in bleeding when you brush. Calculus, also known as tartar, forms when the plaque is allowed to remain on the teeth for too long without being brushed away. The plaque combines with minerals in the saliva, which causes it to harden on the teeth. Calculus builds up in thickness and layers over time and creates an uneven surface, which makes cleaning the teeth effectively even more difficult and in turn allows for additional plaque to form. If you do notice some tartar or calculus has formed during this period, don't panic. The most likely place you'll see it is behind the bottom front teeth. Once calculus has formed on the teeth, it can't be removed by everyday brushing or with incidental cleaning. It requires a professional dental practitioner to remove it for you. Now, you may have seen some home kits advertised on television and social media that claim to give you the resources to remove your own calculus. Please, please, please don't be swayed by the marketing and don't be tempted to buy any of them. If not used correctly, they've got the potential to cause irreversible damage to the tooth surface underneath the calculus, so just stay away from these products. Your job at home is to remove the soft plaque. Our job in clinic is to remove the hard tartar, so leave that bit to us. The calculus won't cause any damage, so try not to worry. Ignore it for now. What's important is that you continue to clean your teeth and disturb the live plaque bacteria that forms every day, and we'll get rid of any calculus for you once we're able to treat you again. Now, if you do see some bleeding coming from your gums, try not to panic. It happens to the best of us from time to time. Plaque likes to grow in areas which are dark and warm and most difficult to clean, for instance in between your teeth. If you see bleeding, it's probably that some plaque has been missed and has been left long enough to initiate your body's inflammatory response. That's just your body fighting back against the bugs that have been left undisturbed for too long. If you do see any bleeding, try to spend some extra time brushing the gum in that area, even if it feels a little bit sore, and the bleeding should settle down again within just a few days. Okay, so now let's remind you what it is that you can be doing at home to look after your teeth and gums. And these really are things that you should all be doing daily anyway, so hopefully it's not too much of a change for you. Number one is, of course, daily toothbrushing. Brush your teeth. Brush them every day, twice a day, and brush them well. It might sound obvious, but during a time when you're out of your usual routine, it's easy to forget. The longer you spend cleaning and the more precise you are, the less plaque you'll leave behind. Remember, plaque likes to grow in the darker, more sheltered areas of your mouth, so try to get your toothbrush bristles around every surface, and especially around the gum line and in between the teeth. Remember to brush your gums as well as your teeth, and it's good practice to get into the habit of also brushing your tongue each time you clean. This will help you particularly to remove bacteria and food particles that can lead to bad breath. You should be spending at least 2 minutes each time you brush, but that really is the minimum. I ask my patients to try and double that. Use a toothpaste that contains fluoride, spit out the excess paste and don't rinse. You'll just rinse all the fluoride away, so you want to try and wait at least an hour before you have anything to eat or drink. Next on the list is incidental cleaning. My patients tell me every single day that they don't have time to clean between their teeth. Well, now's your chance, folks. No excuses. The area between your teeth is where you grow the most amount of plaque because it's dark, it's warm, it's sheltered, and there's a rich supply of food particles in there. If you don't clean between your teeth, it's likely you're leaving lots of plaque bacteria behind. It would be a bit like only mopping half the kitchen floor. You can use incidental brushes, incidental rubber sticks or plastic sticks, or you can use floss. Any of these is fine. Whatever works best in your hands, but try to use the thing that fills the space the best. You want something that makes good contact with the tooth surface. Floss is okay if you don't have anything else, but usually the brushes or the plastic sticks do a more thorough job. Whatever you're using, make sure you move it in and out a few times to be sure you've completely disturbed all of the plaque. You won't necessarily see anything coming out, but that's okay. If you're getting some friction, you'll definitely be disturbing the bugs. If you're not used to using incidental aids, start now. It's never too late. Expect to see some bleeding at first, but as I've already said, this should settle down within a few days, or certainly with some frequent use. If it doesn't, don't let it stop you. Continue to use your incidental aids, and we'll help you eliminate the bleeding once we're up and running again. Now, mouthwash. Don't be tempted to reach for the mouthwash to improve your oral hygiene regime. Mouthwash does very little to stop plaque from building up, and quite honestly, most mouthwashes do absolutely nothing except contribute to stain build-up. If you want to use a mouthwash, then go ahead, but use it purely as a breath freshener. It won't do anything else, despite what the adverts on TV say. It's plaque bacteria and old food particles that cause most bad breath. If you want fresher breath, try to spend a little longer cleaning the plaque bacteria from your teeth instead of trying to wash it away. Stay hydrated. Saliva has lots of functions. One of its really important functions is neutralising the acids that are created when we eat. If you allow yourself to become dehydrated, your saliva flow reduces, which is what gives you the sensation of feeling thirsty. Less saliva means less neutralising of acids and potentially more decay. Try to keep your saliva rate at full flow by keeping yourself well hydrated with lots of water. Try to avoid reaching for sugary drinks. The last thing you want when you have a reduced saliva flow is more sugar in there. Speaking of sugar, try to avoid reaching for the biscuit tin while you're passing the hours away at home. I know it's hard. It takes our mouths 2 to 3 hours to recover from a sugar attack. If you constantly reach for treats without allowing your mouth the time it needs to recover, then you run the risk of causing tooth decay. You don't need me to tell you that now really isn't the time to get tooth decay when every dental practice in the country has been told to close. Save the sugary treats for meal times and stay away from sipping sugary drinks. That includes putting sugar in your tea and coffee. Try to use sweeteners instead, or even better, take this opportunity to wean yourself off completely. So there we go, folks, that's it from me. I hope you found this video useful. Now more than ever, your oral hygiene needs to be of a good standard. It might be a while before we can see you in practice again, so you need to do as much as you can at home. To all of our patients and friends, know that we're really missing being able to give you the face-to-face chairside care that we're used to giving. Know that we constantly have your safety and your best interests at heart. Until we see you again, look after yourselves, look after your family, and please, please stay safe.